Hey everybody, welcome back. Today we're going to be talking about BRASH syndrome. Let me just, it's gonna be BRASH syndrome. Okay, so what does BRASH stand for? I'm gonna expand this first and then we're gonna go into the specifics. B is bradycardia. R is renal failure. A stands for AV nodal blockade. S stands for shock. And H is hyperkalemia. Okay. So a little bit of background before we jump into BRASH itself. So you must already know that that beta blockers, right? They cause hyperkalemia. So this is because the beta 2, whenever it's stimulated, it activates the sodium potassium ATPase, and so when this is activated, sodium comes out, potassium goes in to the cells. Now when you block it, you're letting all the potassium stay in the extra cellular compartment, right? And that is what leads to your hyperkalemia. Okay, now that is one thing that I wanted to say. And another bit of background that I want to give you is that hyperkalemia, right? Hyperkalemia causes bradycardia. I don't know how much you remember, but like mild, moderate, and severe hyperkalemia has different changes on your EKG, right? So if it's mild, it's going to start out with PR prolongation and peak T waves, right? Peaked T waves. When it's moderate, you get QRS widening, and when it's severe, it will cause bradycardia and I think it was like a sinusoidal pattern of some sort on the EKG. But you can go over like the EKG changes in hyperkalemia separately. Let's not get distracted. We're talking about BRASH syndrome. But basically what happens with hyperkalemia is that it reduces membrane excitability, right? And it causes conduction defects like bradycardia, right? Okay, now, so let's talk about BRASH syndrome itself. Now, who are our population that typically get affected by BRASH? So it's going to be elderly individuals, right, who have underlying cardiac or renal dysfunction, like impairment. Okay. So what are so we spoke about bradycardia, renal failure, AV nodal blockade. So can you think of which are your medications that cause you to have bradycardia? The first one will be beta blockers. The second one will be calcium channel blockers. And can you the drugs that cause hyperkalemia and that can worsen BRASH syndrome would be ACE inhibitors and ARBs and potassium sparing diuretics, right? Diuretics. Now I spoke about beta blockers causing your hyperkalemia. Let me give you a little bit of background about calcium channel blockers. So what these guys do is they reduce your blood pressure, and that sort of decreases. Can you excuse me for just one sec? Sorry about that. They reduce your blood pressure. They reduce renal perfusion, and that causes potassium retention, right? Now, so these are the medications, and when you give it in elderly individuals who have pre-existing cardiac and renal impairment, which happens a lot with elderly individuals, you can predispose them to developing BRASH syndrome. Now, let's talk about the pathophysiology of BRASH. What color? Okay, let's do this. So what happens with BRASH is you have your medications, right? They cause AV nodal blockade, and they cause hyperkalemia, right? And that causes severe bradycardia. Then this severe bradycardia causes reduction in cardiac output. That causes reduction in renal perfusion. It causes AKI. That will cause more hyperkalemia, which in turn worsens the bradycardia. So it just becomes this vicious cycle, right, of bradycardia, hyperkalemia, bradycardia again, right? So that for you is BRASH syndrome, which is, like I said, bradycardia, renal failure, AV nodal blockade, hyperkalemia, and shock. Now, what would be a trigger for somebody to develop BRASH syndrome? The first one would be a recent illness. Okay. The second would be medication changes. Like if they went up on their blood pressure medications, they were hypertensive, they went to the doctor's office, they went up on the BP medications, that can be a trigger as well. Another trigger would be hypovolemia, or like decreased oral intake, because that can cause prerenal AKI, and that would like cause retention of the medication, hyperkalemia, and that itself can start this process. So the clinical presentation is going to be that of, let me change the color again, is that of cardiogenic shock. Well, because of the AV blockade and the bradycardia, and it might require pressors. pressors. Now, how do you manage BRASH syndrome, right? So this is okay, the first thing you want to administer is going to be calcium gluconate, because there's hyperkalemia. You want to prevent arrhythmias, and you want to protect the cardiac myocytes from the hyperkalemia. The second one is going to be insulin and glucose, because you're treating hyperkalemia, which is one of the biggest components over here. And you can also give loop diuretics. I mean, you can also give them potassium binders like K-xylate, but because that tends to be a little slower in acting because it binds potassium in the gut, it's not going to be useful in an acute scenario. The biggest thing is going to be dialysis, because it's a kidney problem and you're retaining potassium. The best way to get rid of it in an acute setting would be dialysis, right? And then you have to do continuous cardiac monitoring, which is again, of course, because hyperkalemia can be arrhythmogenic, right? And then you frequently check potassium levels, frequent potassium labs, right? And you have to hydrate them. Well, that's one of the most important things, actually. Yeah, so that is pretty much your overview of BRASH syndrome. Let's just go over it real quick. This is what the this is what the abbreviation stands for. This is who it happens in, what can be the triggers, what medications can are indicated in the pathogenesis, the pathogenesis itself, what are your triggers and how it presents, and finally how you will manage it, right? So that's pretty much your overview of BRASH syndrome. It's a relatively newly described topic. I came across it. I mean, a physician assistant actually told me about it, and that's when I started thinking about it, and I was like, yes, this definitely deserves a video of its own. So that will be your BRASH syndrome. Okay, so guys, thank you very much for listening. Let me know in the comment section below if there are any particular topics that you'd like me to cover. I will see you next time. Have a good day.